Hi everyone, I'm Adam from Kinetics Physiotherapy. I'm a chartered physiotherapist working in the UK. So what I'm going to be covering in this video, we're going to look at tennis elbow, but more specifically self-massage that you can do to try and ease your symptoms at home. I know that's particularly difficult at the moment to go and see somebody to get some soft tissue work on there because we're in the lockdown. So if you're living in the UK or particularly in England, we're in a national lockdown again until who knows when, hopefully not too long. But this is something you can do at home that could be some really good self-help to try and settle down that tennis elbow that's really giving you some trouble. So what we're going to be doing with tennis elbow is looking at the muscles in the forearm here. So tennis elbow is essentially inflammation of the tendon around here. So that really tender spot that you usually get just off that bony bit in the elbow here with tennis elbow. What that is the tendon of the muscles that sit in the forearm here. So the muscles that move the fingers in the forearm, so you can just about see them working on me here. So moving the fingers, moving the wrist up and down, and what they do is they start here. There's a bit of a tendon that attaches into the bone here, which is sort of like a rope. And what it does is it then goes into the muscle here, which contracts, it gets shorter. You can see them working around here and here. And what they do is they travel down our forearm into the wrist and the hand. And what they do is they contract to lift up the fingers. And so it allows you to move your fingers, move the arm here. What can happen is these tendons here, what happens is when the muscles contract, it pulls on the tendons here and it can get a bit inflamed around here, and that's what causes the pain and that tenderness when you're feeling around here. So the main thing to really think about when you're doing any sort of soft tissue or massage to the area is pushing on this tender bit area, or tender area here, the tendon. It'll help a little bit, but it's mainly just going to be sore. So you actually want to focus a little bit further down in this sort of spongy bit around here, these muscles here, because they're the main culprit. They're the ones that tend to get a bit tight when overworked, and that's what causes the irritation to the tendon. So what you're going to start off with, you don't have to, but you can grab some sort of lotion or oil. It just reduces the friction around here. But what I want you to do to start with is just really gently placing the palm on the arm here, just running it up and down, and you want to just using the thumb as you come up, just come across, pushing over and towards here, really gently, just more warming things up. Okay, just coming up and across here, just doing that maybe 4 or 5 times, just pushing up and then across with the thumb there. And then what you want to do, you're going to then go with the fingers across, and then you're going to gently pull towards you, just running your fingers across the muscle fibers there. So across and running the fingers across. So doing 3 or 4 times in one space. And then slowly working your way down towards the wrist here. Again, reaching across. Really almost imagine you're trying to pull those muscles across, so you should feel them. And to know you're in the right place, you can pause over that area and you can move the wrist up and down, make sure the palm's facing the floor. But you should feel something moving underneath your fingers there, or getting a bit harder. And you can move the fingers as well. You should feel something moving underneath your hand here on the forearm. And that's how you know you're in the right place, because the muscles here are contracting. So again, working across towards the wrist here. Don't worry about too much pressure, just nice and gently, just warming things up. And then what you want to do, once things have warmed up a little bit more, so you can continue this for another couple of minutes, up to about 5 minutes really. And then what you want to do is alternating between this pulling across here and then coming up and across with the thumb. Okay, because this is where most of the muscles sit. So we're coming up and across here. Okay. And what you want to do, once things are feeling a bit warmer and you've warmed up the muscles there, then what you can do is get your thumb, put it sort of in the middle of the back of the wrist here, and then what you want to do is just put a bit of pressure here, not too much, and just run it up the centre here. Just go up towards that tender bit that's around the elbow here, not onto it, but just going towards that bit there, and then just ease off when you get to roughly a centimetre away. then come back down here. So running the thumb up nice and slowly, up towards the elbow, and then just easing off there. Then bring it back to the start. So getting that thumb, a bit of pressure, nothing too much, we don't want it to hurt the thumb, and then relax. Okay, again, 3 or 4 times, just going up there, loosening things off. And keep doing that repeatedly, you can get a bit intense. So once you've done 4 or 5 repetitions, give the wrist a bit of a move around and go back to your gentle, just coming up and across, nice and easy. Work all of that out there. Okay, and then back to the coming across. Nice and easy. And then we'll go back to get the thumb, back of the middle of the wrist, then just run it up the middle here. Okay, really try and focus on going along any tender points here. Don't worry too much about how much pressure. You don't really have to hammer home as hard as you can. Really go for it. Just so you feel a bit of pressure there, it stimulates the blood flow, and that's what we're looking for. Eases the tension there. Okay. Lovely. And if you're feeling like either the thumb's getting tired, or you want to challenge yourself a little bit more, what you can always do is clench your fist. Just gently use the knuckles of even just 2 fingers, these 2 fingers here, just putting those again on the back of the wrist, and then just running it up along here. And then we're going to ease off, come back down, and then pressure on, work it up, and down again. Okay. I find this is a lot better when the thumb starts to get tired. It just gives you a bit of a rest. Okay, so, and the other sort of technique you can look at to try and ease a bit of tension in these muscles around here is look at when you're relaxed. You can do it on the edge of the table, resting your arm here, or I'm doing it in standing. But what you can do is essentially you want to bring your arm up like this, bring the wrist up towards you, and if you can, straighten the fingers as well. Get the other hand, and then clamp across the muscles here. You should feel them sort of a bit harder contracted there. Put a bit of pressure here, and then you almost want to grip the muscle, and then what I want you to do is then try and bring the wrist and the fingers down. And then if you can, end up in a position where you've curled the fingers back under. And you should feel a stretch starting to come up along here. So come up, apply the clamp, put the pressure on, and then bring the fingers down, and then try and work towards clenching your fist. Okay. Come back up, apply the clamp, slowly come down, curl the fingers in. Okay, do one more time at the top here by the elbow, so fingers up, clamp on here, coming down, and flexing the wrist, flexing the fingers. You should really feel that coming across here and sometimes into the hand, especially when you're trying to bring the fingers here. If it's a bit too intense and it's a bit too sore, either ease the clamp a little bit or just go as far as you're comfortable with. Essentially, the further you bring the hand round and the further you clench your fingers, the more of a stretch that you're getting on these muscles here. So if you can only get to say here, and that's okay, you can feel a bit of tension there, that's absolutely fine. Just work with no more than a bit of discomfort. It shouldn't be painful. Okay, even when you're doing these, when we're digging the thumb in, or not necessarily digging it, but putting pressure on there with the thumb and using the knuckles here, at most a bit of discomfort. If you really go for it, you're just going to make it a bit sore. You're essentially pushing a bruise over and over again if you do that, and it's just going to make it sore. It will help, but you don't want to then walk around with an arm that's too sore to do anything with. So once we've done a few closer to the elbow, we can work a little bit further down. So again, same thing, hand coming up, fingers extended, clamp goes on about mid-arm, and then bringing the fingers and the wrist down. Try and curl those fingers up there. Okay. Come up, apply the clamp again, and then coming down. Okay, relax, bring the fingers up, apply the clamp here, and then coming down, flex the fingers. And we'll do that one more time. Apply the clamp, then coming through, blend the fingers here. Okay, have a little rest, and then one last place I want you to do is just above the wrist here. So again, fingers up, apply the clamp here. You should be putting this pressure in this. You feel the bony bits either side of the wrist. You want to go dead in the middle here. That's where you want the clamp and that's where you want the pressure. So you can do it with your thumb. I like to do it with my index finger as the main pressure on there, but you can use other fingers as well. We just want to put a bit of pressure on there when it's in this shortened position. Put the pressure on and then bring in the wrist and fingers down. Okay. Back up again. Pressure goes on. Bringing that down. Okay. Put the pressure on again and coming through. And one more time, bring those fingers up and the wrist up. Put the pressure on. Bring that down and through. Okay. Have a little rest. Just finish off with some gentle up and down, and going back into that, bringing the hand up, using that either the palm or that web space between the index finger and the thumb, coming up, and then the thumb comes across. Okay, nice and gently, just helping stimulate a bit of blood flow to the area, just to finish off. And again, going back to that, combing through the muscles with the fingers. So, I hope you found this little follow-along video helpful. If you did, let me know. Leave a like and subscribe, and let me know in the comments below as well. Also thinking of doing a little acupuncture tutorial, just to give you an idea of what to expect if you do go and see a clinician about having acupuncture for tennis elbow. A lot of people get quite apprehensive about having needles put in them, particularly in the forearm here. Honestly, it's nothing to worry about. I'm not a big fan of needles, but they're so small you don't even really feel them, but they can be a really good way of settling it down. If that was really, really uncomfortable for you, try easing off the pressure a little bit. Some people can't get on with it. Try a bit of acupuncture. It's a little bit less invasive because of the fact that it can be a bit uncomfortable when you pop the needles in initially. Once they're there, generally, you don't really feel them. And it can be a nice way of settling down, stimulating that blood flow, similar to what we did today, but a nice way if it's really, really severe. So let me know if that's something you'd be interested in seeing, and I'll see you in the next video. Thanks, guys.